Hello, my name is Robert Pulver, and I'm the Healthcare Compliance Officer for this healthcare organization. I'm here to talk to you about moral right to healthcare. First off is our moral right to healthcare is code of ethics. We have a couple different principles on that with healthcare providers and patients, and I'll go over Trinity Health Code. According to Higgins, central to medical ethics is the requirement that physicians put the interests of their patients above their personal interests. So once you take it on yourself to become a healthcare provider, you're there for the patient and to do what's best for them. Patients trust us to do the right thing. According to Bustillos, Trinity Health developed a code of guiding behaviors that encourage the following 6 characteristics. We support each other in serving our patients and communities. We communicate openly, honestly, respectfully, and directly. We are fully present. We are all accountable. We trust and assume goodness in intentions, and we are continuous learners. So as healthcare providers and in this healthcare organization, I'd like us to take these thoughts forward and operate in the best interest of the patient under the organization's vision and mission. Next up, we'll talk about Stark Law, which started in 1989 and is also known as the Ethics and Patient Referrals Act. And this was put in place to protect patients from any wrongdoing by providers. How Stark Law came about was physicians doing unnecessary testing or having some sort of financial gain in order to treat patients. According to Bustillos, self-dealing by physicians had become common and was a major source of unnecessary testing and treatment, as well as adding risk for patients. So while the physicians had financial implications and gains to be had, it was at the cost of the patient's health. The rationale for the law was a concern that physicians were more likely to order tests if they had a financial stake in the provision of such services, according to Wool and Barrett. So as providers in this healthcare organization, we'd like to operate in the best interest of the patients and make sure there is no financial implications or Stark Law violations moving forward. Next up, resource allocation in healthcare. That's a basic human need for our patients, and we have an organizational determination based upon our vision and mission, some tough choices and monetary decisions that come into play that affect both provider and patient. I take upon a story, according to Bustillos, in the 1980s, a healthcare organization had a pediatric patient that needed a bone marrow transplant, and cost was $100,000. Medicaid would no longer cover organ and tissue transplants during this time due to cost for them, and the hospital determined it did not have the funds for his procedure, and this young patient died before the funds were fully raised by the community. So the healthcare organization had a tough decision to make in this, and they made one that ended up affecting the life of a young patient of theirs. So as we move forward and make these decisions that are best for our organization, we have to take into account the patient, which brings up the utilitarian theory. According to Reddy and Theory, utilitarian theory holds that the morally right thing to do is one which produces the greatest good outcome for the greatest number. So as a healthcare organization, we want to do things that will help the most amount of people and to our power the best outcome. According to Doyle, the greater the disability caused by the illness, the greater the moral entitlement to effective treatment. So depending on how the patient feels, they think they have that moral right to health care and that sense of entitlement just based upon their understanding of their diagnosis or their feel on the healthcare process. So as a healthcare organization, these 3 things help establish a patient's right to healthcare between moral and ethical obligations. And as a healthcare organization, we have to look back upon those things we talked about earlier regarding the Trinity Health Code and our ethical obligations to treat patients and do the greatest number of good for the greatest number of people in our community. Thank you for your time.